You're the head of Neglected Tropical Diseases Program at FIND, the Foundation for Innovative New Diagnostics. My question to you is, what is the role of research in new diagnostics? And your colleague, Dr. Gracils, was talking about really the importance of diagnostics, especially in the challenges that you face. Now, what is the role of research in new diagnostics if we are to move to end NTDs by 2030? Do we have the tools necessary for surveillance to prevent the reemergence of diseases once they've been eliminated? The entire equation is fragile, and Dr. Gracils pointed to that. Could you tell us what your views are, and given your experience in this area, Dr. Ndung'u?
Thank you very much. Thank you for inviting FIDE to participate in this important event. FIDE is an international NGO that supports the development of diagnostic solutions for diseases that are associated with poverty. Within the NTD program, our flagship project has been the development of the first ever rapid diagnostic test for sleeping sickness that has been talked about yesterday and today, and which is now in use in at least 17 of the African countries where it is having great public health impact. And for that, we want to thank the partners who have worked with us and the funders for that. Now, in order to be able to administer treatment, it is important to have accurate diagnosis. And when we move from just treatment to disease control, it is important that wherever we are carrying out disease control, we are using technologies that enable us to identify the infected individuals accurately. Moving from disease control to the current effort to eliminate diseases, we are faced in a situation where the demands for diagnostics change over time. As we near elimination, the diagnostic tools that we require to be able to identify or to detect that individual who is infected must be highly accurate, highly specific, to ensure that we are treating the individual who is infected. For some of these diseases, that individual could also be the reservoir of disease, and therefore, if we are moving towards elimination, we want to look for ways in which we are able to identify that reservoir of disease. So the diagnostic solutions that we look for as we move towards elimination of the disease have to be highly accurate, highly specific, easily delivered, and are able to be delivered to cover the entire population that is at risk. Now, the 2020 goal, the 2030 goal is talking about elimination as a public health problem. It's talking about reduction in number of cases to 0. We are, for most of the diseases, not talking about eradication of the disease, which means that at that point, we will still be living with us in a situation where the risk of reemergence of the disease can occur. So we are going to need to come up with tools, and not only tools, but also strategies that enable the use of those tools to sustain a surveillance program so that we can detect reemergence as it occurs. So there's going to have to be smart ways of doing that, because at that point, the healthcare system will not be having a lot of attention for such diseases, and that is when reemergence can occur. And one of the smart things that we think could be done is integrating some of these diseases with others that are co-endemic. And I'll give an example of sleeping sickness and malaria. Wherever you fight sleeping sickness today, you fight malaria. One can imagine development of a test for diagnosis of malaria, which is quite prevalent, while at the same time it is conducting surveillance for sleeping sickness. So the patient will be sent to the health facility for diagnosis of malaria, but since this test is also able to detect sleeping sickness, then there is passive surveillance for this disease as we go along. So the take-home message is that not only are we going to require diagnostic solutions to be developed in the post-elimination era, but we are also going to have to come up with smart ways of ensuring that the surveillance strategies are delivered and they are sustained. Thank you.
Thank you very much. We're going to move to Professor Hotez